Digital dentistry, and particularly intraoral scans, from like iTero, have really been absolutely game-changing for us as a laboratory. The ability to receive a scan, assess it for the clinician, make sure the preps are right, any adjustments, any minor trimming we need, path of insertion, a missing margin, that can be fed immediately back to the dentist. And that really builds the relationship between us and the clinician, and of course the clinician and the patient. It builds trust. And we can very quickly overlay scans, we can overlay wax-ups, which we can't do conventionally. We have to pour the model, we have to trim the dies. It's time consuming, it's messy. And digital dentistry is a really slick, clean process. I can check the scans literally with the patient in the chair. I can feedback anything that needs to be adjusted. If it does need to be adjusted, it's not a case of putting retraction cord everywhere and retaking that huge, 10 unit impression. It's a case of using the little eraser tool, maybe taking out a small bit of the bite reg, or maybe a little margin is a bit short, removing that tiny bit and just rescanning that one part. So the benefits of digital for me, if I could have all of my customers using digital, I would. I think it's definitely the way forward, and it's game changing for everyone that wants to get involved in a new way of doing dentistry. One of the nice things with iTero is that what we have called the iTero-exocad connector. What happens now is the scans now come immediately through to my exocad software. So what I can do is I can immediately assess that scan, and I'll give you a prime example. It was only last week that we had a scan come through from a clinician. It appeared on our exocad, and we just automatically check the scans now. And it was very clear to us immediately we had excess saliva on one of the scan bodies, which gave a bit of distortion. That happens with all scanners. It's just the nature of dealing with the mouth. And we managed to immediately use the connector and direct message through our software straight back to the iTero. It appeared at the iTero the scan body was potentially distorted, and amazingly we caught it before even the scan body had been unscrewed from the mouth. So the dentist realized that, didn't have to rescan all the arch, just the little lateral scan body, erased it from the scan, cleaned it, dried it, rescanned it. Within 3 to 4 minutes I had the scan back, checked it, perfect. Now normally that would be removal of scan body, put the healing back in again, send the patient away. I've got to make the awkward, embarrassing call of the impression is not good enough, get the patient back who's then frustrated, and redo the whole process. By using this iTero connector, we managed to identify that as good as immediately, and quick rescan, patient didn't realize anything was wrong. We've saved chair time, patient's trust is through the roof, great relationship between me and the clinician, but that can only be done when you're using a good iOS scanner and a connector like, for example, the iTero-exocad connector software. I look back at the old way we used to do dentistry, and I suppose I'm a little bit mortified. The new way of doing it is just so much more ethical, and it really engages the patient into modern dentistry. It's a really good tool. So never think of your iOS solely as just an impression taker, because it's something vastly more powerful than that. And a good iOS really has the ability to revolutionize your practice.